figure. I can only see Tracy.
We are live.
Okay. All right, we are going to return to regular session. Everyone, please silence electronic devices, and we will have the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You guys all forgot to take your mutes off, but Brian and I had it under control.
It was a duet.
Additions and deletions to the agenda since Friday mailing. We do have some. Sue here?
Yep, I'm here.
All right. You want to announce our additions?
Sure. We're going to have 3 additions and 1 correction. So we're going to be adding 6.11 regarding an agreement, a settlement agreement. 7.7 is going to be the resignation of Christina Hoffman. 8.5 is just a correction. I transposed or misunderstood the start date for our student teacher. And we're going to be adding a student teacher from the College of St. Rose to work in the special education in the middle school.
Perfect. Thank you. Can I get a motion for the additions and changes? Mr. Engel, Mrs. Hoteling, all in favor?
Aye.
Aye.
I need a motion for the acceptance of the minutes of the December 16th, 2020 meeting. Mr. McFerrin. A second. Mr. Engel, all in favor?
Aye.
Okay. We have no awards, honors, or recognitions. We have no hearings and petitions. I need a motion for one or all of the business considerations.
Motion for all, 6.1 to 6.11.
Okay. Do we have a second? Mr. McFerrin, do we have any discussion? All in favor?
Aye.
Aye. Okay, I need a motion for one or all of the personnel considerations.
Motion for all, 7.1 to 7.7.
Okay, I have a second, Mr. McFerrin. It's quick, all in favor?
Aye.
Do we have any retirements in the personnel consideration?
Yes.
Should we call that out?
We do have 2 retirements, or 3 retirements listed here. So the Board of Education approves with regret the retirements of Joanne Bayless, Jill Riddler, and Sharon Muth. Hopefully I was close.
Yes,
so,
very good.
Appreciate all the time that they've put in at RCS, and hopefully they enjoy retirement. Informational item 8 through 1, 8.1 through 8.5. Special reports. I have nothing. Any Board of Ed members have anything to report on? We will turn it over to Dr. Bailey.
Those of you, again, who've watched the news, you see that there's a lot happening around COVID in the area right now. We're at some all-time highs in the numbers of positive cases. You might remember that when we reopened in September, the governor had set an initial benchmark that if there was a 9% rolling average over a 7-day period, a school would be placed in a zone, or a region would be placed in a zone. And since the September, those numbers have been fine-tuned because I think he's added in the element of space within emergency rooms and hospital capacity. I think might be in day 4 or 5, over 10% in our region right now. So although the metrics have changed somewhat, and I forgot to mention, based on a call with the Albany County Department of Health this past weekend, it appears as though we're also nearing our capacity in emergency room beds in the region, which is surprising because we have a lot of hospitals. But we have to remember emergency room beds don't just include COVID patients. It includes patients with all kinds of illnesses. It's easy to forget that considering the things that we're facing right now. So there's a likelihood that our region would be placed into a zone. And I've talked before about yellow zone means that you've got to test 20% of your population over a 2-week period. And a red zone and an orange zone requires you to test 20% or 30% over a month, but you continue testing. With the yellow zone, if you're able to test and you demonstrate that you're lower than the region, you're just fine. So I wanted to share 2 things with you. One is I wanted to share with you a consent form around testing, because we know this is coming soon. This is a great basis for discussion because it's a form that's not gone out to families yet. We're going to distribute to families electronically tomorrow and in print to families this week, Thursday, Friday, to those that are in person, and then the remainder that are in person when they come back. But testing is only relevant to in-person staff and students. So let me share the form with you so we can talk it through a little bit. And the good news is, as you form questions and you have some wonderings about this, we can improve it before it actually goes out to families. I'll make it a lot bigger. It's a little small here, so too big. So it includes the governor's cluster initiative, and I'll be honest and say that can literally change at any moment. Obviously, it's continued to change, I think 3 times since it came out in September, because it isn't just about positivity numbers. And I forgot to mention also, when we say 10%, it means that if 100 people go and get tested for COVID in this region, 10 out of the 100 test positive. That's how we get 10%. I've always wondered that myself. So this is informational. It's a consent form that will go to all families. And it talks about the testing methodology that will be used, which is called the Binox card. And there's some videos included in this, and I'm actually going to show the video because it's pertinent. Almost all of you have children in the district, and this is very relevant to the experience that they would have. So testing will only begin if the Governor Department of Health tells us to. So until then, we're not going to be testing in our schools. We must randomly test 20% of our students if we go into a yellow zone. And as long as we're under the regional average, if the regional average is 10% right now, if we're at 7%, we no longer have to test. If we're orange or red, orange means testing 20% over a month, or red means 30% over a month. And the requirement is actually 10% in the first 2 weeks, 10% in the second 2 weeks. And you continually do that throughout as long as that stays into the zone. Testing will occur within the school building, and all of the regular precautions that we're expected to take will occur. Social distancing, masks, hand hygiene. The analogy I was going to use is like an eye or an ear test, like we would have done in a normal circumstance, like at the elementary school where a class comes down, you have your eyes tested by using the little Viewmaster, or you have your ears tested using the headphones. This test is very non-invasive, and it's a very quick experience for children. Ideally non-traumatic and non-invasive. And the results of each test take about 15 minutes. We notify negatives in writing, and we notify positives by making a phone call. That's the same thing right now. If a student is sick in school, we have to call home, and the student has to go home. If a student is positive in school, the same thing will happen. The parent will be called, and they'll have to come and pick up their child. Only students whose parents or guardians have provided this consent form will be tested. That's important to note. So we'll be taking random samplings. We won't test the same child every day or every month or every week. We'll be taking random samplings. And our hope is, I gave an estimation, we have 1,800 students, about 1,200 of them are in person right now, over a number of days. The number that we have to test is relatively low under those conditions, 240 students. Or I should say 240 students, we have 400 staff, 425 staff, so we'd have to test 80 of those folks. So sum total, 320 people in the district have to be tested over a 2-week period. And that'll be a good, it'll include a great number of staff. It'll include some students. Even if half of the parents agree to have their children tested, we'll have a large enough sample to fulfill what it is that we're trying to do. So the sample will be conducted or collected by a team of RCS staff and a health professional that BOCES is going to provide for us. And you'll get a chance again to see what this looks like when they collect the sample. The sample will be collected through a nasal swab, not like the one that most people have done at SUNY Albany, which goes all the way up to the inner ear canal, or sorry, into the upper nasal canal, IXK near your brain. It's not that kind of test. And again, you'll see that in the video. And the tests will be tested. The results will be found out in 15 minutes. And this link goes to the Binax now, which I'm not going to click on right now. So we just ask parents to figure this out, or to fill this out. And we've included a frequently asked questions. Will my child be tested over and over again? I mentioned that, answered that. How invasive is it? We're going to show the video and show you. Will my child's confidentiality be maintained? Absolutely. Can I draw permission? Oh, can I withdraw permission? Yes. Who'll be tested? Only in-person students. And what does the actual testing process look like? I'm going to play that video for you in a second. When will we place in a zone? We don't know. It's really up to the Department of Health and the governor. What if my child shows symptoms? Well, they shouldn't be in school to begin with. So if your child is symptomatic, they'll be sent home regardless. We won't be testing students who are sick. Those students should not be in school at all. And if I don't consent, will my student be forced to switch to fully remote? No. Can I be present while my child is tested? No. We are not inviting families or guardians or anyone else into the school. We have an envelope that we're preserving. And what if they test positive? I already mentioned that. I'm going to show the quick video, and then I would be interested in hearing some questions from the board, as you are, a number of you are parents. So the video is really quick, and this is our friends at the Manan School. Because they already have the tests, we're able to do a quick video in order to demonstrate what this would look like for their families. So ideally, you'll be able to hear it as well.
Hi, I am Karen D'Ambro. I'm the school nurse here at Manan School. And you recently have received some communication in regards to consenting a COVID test here at school. And I'm here to show you what that will look like. This here is the actual kit that the test swab will be done in. So I'll be using this kit as well as a solution inside the kit to be able to give me a result of whether or not your student has COVID. Inside the card that does not come in contact with your student at all. The only thing that will come in contact with your child is this swab. So it's a normal nasal swab. It does not go all the way up into your nose. Those are the nasopharynx tests. We will not be doing that here. We only do a simple shallow nasal swab. So our test subject, Madison, if you could take your mask off. It's just going to go right inside your nose. It twirls around. And then other side. I'll take it and put it inside the card. I spin it inside the card. Take the adhesive off, close it, and set my timer for 15 minutes. So everyone, it's been 15 minutes. I am happy to report that Madison's test is negative, and I know that because there's one single line versus 2 lines. Should your child have 2 lines, that would be a positive rapid test. And I would be contacting you by phone to ask you to come pick your child up, and we would be discussing what the next steps would be, which could be inclusive of having a formal COVID test or possibly quarantining at home.
What we know about the rapid tests, because we've had rapid tests almost from the onset of the COVID pandemic, rapid test positives are deemed to be accurate. Rapid test negatives are not always deemed to be accurate. So for instance, someone who is symptomatic who has a rapid test and it's negative, they would be asked to go get a PCR test or the lab test instead. So you see, it looks like a pregnancy test. It has the 2 bars. And the student's experience would last about a minute to 2 minutes total. So the students
would they go back to class after they take their test, Brian?
They would.
So that was my question. I didn't know if they waited around the 15 minutes, if you isolated them for 15 minutes, because if they are positive, they've been put back in class.
Well, what we know is that you're asking a great question. We are already implementing all of the safety protocols that protect people in the event that they're positive. We presume every single person is positive, and that's why we have all the safety protocols in place.
So if they do come back positive, I mean, do we going to quarantine staff, students, and everybody they've been around that day or the day before? Or are we going to wait until they go get the real COVID test, which then will take 2 days or 3 days to get results back before we start quarantining people?
As of right now, a rapid test positive is considered to be a positive.
Okay.
Yeah, people are not asked to go get another test in the event that they appear to be positive. That's both good questions. You know, in light of that, let me explain one step further. That person did the test by herself. What our model would look like is it would be a 4-person team. It would be a greeter who would recognize the student, who would welcome them and acknowledge who they are, and probably put the label on that test kit you just saw. And then there would be medical personnel administering the test. That's the person we would invite to come from BOCES. Then there'd be someone who times the test, because you can't wait 15 minutes. You got to go ahead and test the next person. So the 3rd person would time for 15 minutes. And then the 4th person would be our data entry person, because every single person who's tested needs to be recorded in this database that we have. So it's pretty intricate. She made it look super easy, but the process from beginning to end, the accepted model is a 4-person team that does this work. That team would do all their work in one building. They'd finish up. They'd go to another building, they'd finish up, they'd go to another building. So the team moves, people continue within the space in which they are working. You asked some...
Brian, the other question I would have is, the kit itself had one of the, whatchamacallits, I call it an SKU thing or whatever. Would that be sent home to the parents so that they could get the results also? So you know what I mean? It has something that identifies who it is, and it's a little code bar thing.
QR code.
Yeah, that's it. QR code.
It's funny, between when we started this process of the Binox Now, which was not that long ago, it was 3 or 4 weeks ago, it didn't include that. But the link that I have in the consent form to the Binox Now website, now their whole pitch is, barcode in, find out your results right away. That's not us. But they are doing that because this Binox Now test is one that it's a $5 test. Just so you know, the state is paying for the test for us. We're not paying for the test. But if you were a business and you wanted to test every employee, you could do this. You'd give them a barcode. You would let the employee scan the test itself, and then they'd be able to self-check on their app. We're not doing any of that. Instead, what will happen is the child who was tested would go home with a letter to their family that says, your child was tested today, their test was negative. And it'll also say, this negative test was done with Binox Now rapid test. It is not a guarantee that your child is negative. That if your child is symptomatic, this is what you do next. Bill, you asked the question about if someone tests positive, will everyone be quarantined in the classroom? That is the same protocol as what happens now. We discover I think at the middle school, just before the break, we discovered someone was positive in a classroom. All the students and the staff members who came in contact at all, and contact means in a room for 15 minutes or more, doesn't matter if you have masks on, they all become a part of the contact tracing. So yes, they would all.
So it'd be really efficient if we got back to that student before, right at the 15-minute mark.
Yes.
Because they would have been out for a couple of minutes. You get back to them right at the 15 minutes. It's only been 14. Everyone's good.
Then we should test them when they get off the bus. I see where you're going. This is good.
Now you see where I'm going with this. You'd be very efficient at this.
There was a second question. I wanted to write it down. I know he answered one. Bill's asked one about whether students we send right back to class. Oh,
Teddy asked the question about, I think you handled it, though. I think that was the quarantine one.
Right.
The only question I have is with those who we've said tested negative, we're not going to advise them that they have to get tested unless they're symptomatic. Are we going to tell the parents when we're testing them? Especially for the young students, I think that parents might want to know.
Oh, you mean like so that they know when their child comes home ahead
of
time?
So that little Johnny, 5-year-old, isn't saying, "Hey, somebody stuck something up my nose today," because that's what it would probably come back as. It's not.
Here's what my compliment to this process will be. We're going to send the consent forms home this week because we want people to agree to be able to participate in this. To that end, Bill, what you've just described, we'll know. It's a 2-week span of time. It takes 15 minutes to get the results, but you could do 10 people in 15-minute period. You do 30 people in an hour. To get to 320, that means 10 to 12 hours over a 2-week span. We can forewarn families that we'll be testing in a building beforehand. We'll be able to send that out and say, just wanted you to know, we'll be testing students in A.W. Becker tomorrow. As a reminder, here's what the testing looks like. And we'll be sending a letter home with your child if they were selected for the test.
Okay.
That's a great idea. Thank you.
So Brian, what are the numbers again? The samples? It's 20% of the in-person attendance over 2 weeks or every day for 2 weeks?
Nope, over 2 weeks. Yep.
And can you retest the same person within that 2 weeks?
Yeah. We wouldn't do that. No. It's a single sample, one person within that 2-week span of time. And the other thing, they say random sampling. Random sampling just means it's not targeted sampling. Like we say, we're going to test everybody at Peter B and not test anybody else. That's not random. Or we're only going to test staff. That's not random. But if we said we're going to test 2, 4, and 6, and then do people at transportation, and so we have some leeway as to how we implement this. They're not going to be asking us to tally, but listen, if we're going to be genuine about it, and when I met with the superintendents a couple of times over the weekend, we all believe that we are going to be far below the regional average for what's been happening. Schools have proven to be among the safest places for our children to be, and it's outside of school where they're in social events, they're congregating to play basketball, they're doing other things that potentially lead them into trouble. But while they're in school, they're reminded of good hygiene, they're reminded of good protocols, and they're learning in a safe environment. So we believe that will be a safer place. So what are your other thoughts about the consent form? Listen, it was a hairy mess of paragraphs before. We tried to bullet it so that people would see like, oh, this is how it works. So I am interested if you had any more commentary about the approach.
I think we're going to struggle to get people to consent to it. I think we're going to struggle to get the numbers we need so we don't have to test the same person every other week. I mean, they may get a
You can test my kids every day. In fact, I think I would prefer it.
What's the consequence if we don't test?
Are you behind curtains?
The consequence for not testing is that we'll have to close. We can't have in-person instruction. So that is in the consent form. It does say we're hoping that we have people voluntarily agree to this because the testing is a contingency of us being able to continue to provide in-person instruction.
So why can't we just say, as a part of telling us you want your kids to be in person, that this is a component of it?
Yeah, there's some things that I've got to send a communication that is the introduction to the fact that this is attached to it. I'm going to try and project those compelling reasons.
I mean, when we sent the letter out asking people whether they wanted to go hybrid or remote, what was it, 20-30% that didn't send the letter back? So, I mean, right from the get-go, we're going to get 20-30% that are going to just throw it in the mail and not even look at it. And then we have to hope how many others actually are going to give us consent.
Mm-hmm.
I mean, you're right, though. Other schools are doing this. So, I mean, they have gotten other parents, obviously, have agreed to it. So, I don't know, maybe we worry too much about it, but I think we're going to struggle to get the consent forms back.
I think a lot of parents are willing to do whatever they can to send their kids to school. So as long as you let them know that if they don't fill this form out, they're going to be home. I think you're going to get a lot of people to fill it out.
Yeah, I agree.
That's a good way to put it.
Yeah.
And Brian, we have to send consent forms out to the 18-year-olds, or are they able to sign themselves?
We have continuously treated our. Sorry. There we go. We've continuously treated students who enrolled by their families at some juncture as though they were in the care of their families. So that's how we would assume that would happen. Legally, you're right, an 18-year-old could sign off on it, but we give parents a lot of control over this process. I mean, the process until graduation. It takes a lot to emancipate, it's a good question. We'll have a few that may, but you are right. An 18-year-old could legally consent to do it on their own, but we'll involve the parents in the process. The other document we're going to send out to families is I'm not going to bother showing it to you because we need to move on, but is a document around what quarantine looks like. What we discovered after the break is families were everywhere. We love our families and we want to spend time with them. And some of them are in Connecticut and Massachusetts and New Jersey and Malta. And people have inadvertently exposed themselves to things they shouldn't have. They're placed in quarantine. And not everybody understands what quarantine is. They're not behaving the same way. In other words, or they're positive and they're not trying to separate themselves from their loved ones. So we're going to send out a single page that just gives them the CDC advice about how to quarantine yourself, what that means. Like we've had parents who arrived at school to pick materials up. They're supposed to be in quarantine. They're not understanding what quarantine means. We want to slow the spread. So we're just going to send out like a little PSA about with the CDC links to it. About how to responsibly self-quarantine so that you're not inadvertently causing a problem in the community.
Brian, did we have any families or staff that traveled out of state on the holidays that affected attendance on Monday, Tuesday?
To my knowledge, there were only 2 people that reported, because on our attestation we have 4 separate, areas that you attest to. One is traveling out of state, and the people who had said that they were people who were inadvertently exposed in some way. So it's irrelevant where they went; they were exposed to someone who was positive. You know what? The draw to spend time with your loved ones is just, it is too great, and we've been deprived for so long. People who are perfectly sensible in every other circumstance. Some of us have made mistakes. We know some people who were exposed in some way, then went to see their families between Christmas and New Year's, and they've exposed their elderly family to it. I saw my mom. I saw her outside from 20 feet away, where we had a great conversation for an hour. This is a time of sacrifice to ensure that we're all around at the next holiday to do what we need to do. It's very hard because we love the people that we're closest to. There's some hard lessons here, and ideally no one has to learn them through a loss of someone that they love. You probably know that we're in an unusual circumstance also, where we have Peter B in grades 5 and 6 in session right now. This is a little bit avant-garde decision, as opposed to having no students be able to come in because we have enough staff and enough transportation staff who are not at work. Our sole purpose when we came back to school in September was to ensure as much in-person quality instruction as we could for our children. This week, the best that we could do was one elementary school in grades 5 and 6. We hope to go back to some normality next week. In the event that we can't, if we can manage it through transportation and through other staffing, we'll switch, where Becker will be in person and maybe Peter B will be remote, and we'll still do grades 5 and 6, because the benchmark we set was our students with disabilities who are in self-contained classes and grades UPK to 6. That's who we consider to be the most fragile of our students. So we're going to continue to adapt to try and do what we need to do. But we fully acknowledge this is a huge impact on our families who need to go to work, who don't have childcare. As for instance, Sunday we notified at 7 o'clock. I got feedback from families about that. And the reason that happened is we are erring on the side of trying to be open. And we were close on Friday, and by the time we got to Sunday, we were unable to open the way we wanted to. So the promise that I made to the families that I've spoken to is that we're going to err on the side of closing so that we can give adequate notice to people, rather than waiting as long as possible and ending up placing them on onus that they can't handle. Sunday evening was too late to notify people that we had to close due to COVID-related absences. We're better off notifying people on Friday, even if it's marginally close, that we're going to close, rather than making people wait. That was one thing that we clearly learned from trying to do the right thing, and we couldn't do what we wanted to do as we entered this week. Our architects presented, John Sharkey presented to us last meeting. We're moving forward with phase 3, and we're targeted for construction in the summer of 2021. The board made it clear we want to move forward with that as quickly as possible. John and his team have taken the work of the former architects and have started to adapt it to what's relevant for now. We've applied to the State Education Department for a waiver to do some modifications to the plan that was in place. And if we can get our paperwork to SED the first week of February, John believes that we'll be able to do that construction in the summer of 2021. And as a quick reminder, the overview, the construction involves the art room at the middle school and the fax rooms at the middle school and high school, and then the front offices and the front office suite along the front of both elementary schools, so that they're a little bit more consumer friendly, building some conference space in there. But we're going to be boldly moving forward with that, and you'll see an invitation to be part of construction committee if you're interested in doing that. Much of the planning's been done already, but it's important to be able to watch the ball, as we've all learned through our construction projects.
Brian, I know the last time we were looking to get something going in short fashion, there was a concern about the timeline of approval and putting things out for bid and being able to turn around and start a project within a short period of time. Is that not something we're worried about this time, or are they going to put it out for bid before we have approval and hope it comes in time?
Because we already have a form of approval for some of the work we're going to do, making modifications is significantly less impact than asking for a complete reboot on what we're proposing. The majority of the work that we're proposing is an adjustment or exactly as planned. So we're in a good position to be able to move forward with that. John's pretty confident that we'll get the approvals that we need. And interestingly, because of all the other things that are going on, that component of SED right now seems to be more responsive than they have been when times were, well, say, normal. So we are hoping that, again, if he gets it in by the first week in February, second week in February, that we'll be able to hit the mark. If not, it is sensible for us to hold off and to wait. I just wanted to let you folks know we have a registration for kindergarten and UPK right now for next year. I've encountered some questions about catchment area, which happens every year. I just wanted to let you know our philosophy about catchment area. If a family lives in the A.W. Becker catchment area, we want their child to go to Becker. The biggest reason is that childcare is, whether it's a family member or a commercial childcare, it's sometimes fickle and it's sometimes unpredictable and sometimes changes. So we do not promote school choice. We want people who live in a catchment area to enroll their children in the building in which their house resides. There are some instances where people have family members in the opposite catchment area. I wanted you to know that I have hard conversations with families, and I do let them know that we do not allow families to choose where they enroll their child. Instead, we use residency as the basis for why someone is enrolled in a particular elementary school. The only exception to that is a child who receives service that is not provided in their catchment area. And we have a handful of children who are transported across the district lines because there's a specific program, usually related to students with disabilities, always related to students with disabilities, that is not in the catchment area that they're in. And you know, board members who've been on for a while know the emotional component of that, you know, when we've had to transport people. So because this is the time of year when we have new enrollees coming in, I wanted you a reminder of what our thought process is. And this is where we've been for the last 3 or 4 years too. So it's not a drastic change from that. And lastly, we've had discussions about extracurriculars and how our students support their social and emotional health. Our bowling and swimming teams have been practicing and have begun their meets and their tournaments. The swim meets have been virtual, and I believe the bowling tournaments have all been virtual. I know they just had one that's virtual. But as I mentioned before, if and when they are ever in a commercial property to do that, they are socially distanced and they follow the protocols that we would follow as a component of the day in school. As of right now, no other sports have been approved in our council. And the jury's still out on what's going to happen with the second winter, you know, that they're going to have starting in February, March. They still haven't made a decision about whether they're going to take some of the fall sports and move them into that time period. But that council is supposed to meet this or next week to be formulating some decisions about that. And the only other thing I was going to mention is that we've put all our information about school clubs on our website, but we're going to be holding a club fair for students in the next couple of weeks so that students are aware of what's out there and that they should be participating virtually in these clubs that we've made available to them.
Brian, are we going to look to communicate as we find out stuff from the Colonial Council or from our council about, you know, what sports may or may not be moving forward? I do find it hard to find any information with regards to what's going on. You know, dates have passed. And I just think that if there is information, we should be putting it out there so that people are aware of what's going on. You know, we can't control, obviously, the decisions, but we can communicate them.
Yeah, and I will confess that the biggest issue right now, and you know, it's our some of our nursing staff who notified us that families are calling and asking about this date or this program, is that the council was supposed to meet before today, and they didn't have enough, or before Monday, and they didn't do it. So there hasn't been any information to share out. But sharing out a lack of information is just as meaningful as sharing out that there is information, because right now everybody's wondering. That's what the nurses encountered.
Do they meet virtually? Does Bob meet with them? Do the ADs meet as a group to discuss and plan? Could we maybe get an update from the athletic director about what's going on? That might, again, nothing may be an official thing, but it could get information out there. Maybe we could communicate back to Bob or through Bob what our expectation is about trying to get information posted, whether it be to our apps or on signage, so that people aren't wondering what's going on.
Bill has made a shameless plug for our app. Everyone should get the RCS app. You're exactly right. And the meetings
should be on the first page and at the top.
The meetings, Bill, are actually for the athletic directors, principals, high school principals, and the superintendents, and they haven't had it yet. But you're right. Because in the absence, we promised people a timeline back in September or October. We need to deliver on the promise of what's happening right now. We'll make sure that happens before the end of the week.
Yep, but Brian, aren't some of these things going to be dictated by the state versus even what the council gets to make a decision on? Like, I mean, if the governor says, you know, you can't play football, then it really doesn't matter what Colonial Council says, or you can't play wrestling or whatever the sport is, you know. So, I mean, how much is the council going to have control over versus what the state's going to allow?
I'll be frank and say that the biggest problem is that nobody wants to be the person that says you can't do that. So New York State is remaining silent. NISFRD, the New York State Athletic Council, is remaining silent. The section is remaining silent, and they're saying school districts can decide how you're going to do this. So the council is the one that's left to say, all right, we've got no guidance. What is it that we want to do that's sensible, that fits in with the work we've been doing so far in schools?
So I think they have some guidance. They just don't have all guidance, right? High risk, the guidance is that's state driven, right? True. High risk is high risk sports, and they've listed what those are. Moderate risk and low risk are not a part of that. So we can make statements about here's where high risk stuff is, right? And here's what would need to happen in order for us to be able to do something with that. Here's where moderate risk is, right? We're in the midst of winter or traditional winter moderate risk, and what's the other one? Mild risk or sport, low risk sports. They do need to make a comment, or NISFA or the state about. I'm assuming it's NISFA that would make the decision about winter too, and there are moderate risk sports that are associated with that. There are high risk sports associated with that, and what that means, right? And the same thing with spring 2 or 1 or whatever it is called, you know, and what that means. I feel like we can't just check it out and say we have no information, because we do.
Correct. You're right. And we can do that, and it affects a lot of families. people are keeping an eye on it. We'll promise we'll have a communication out by Friday at the latest.
Pete, you have a question? I saw the raise the hand, Pete. No, you're good. All right.
No, I was just playing around.
7:31, motion to adjourn.
We got to go to Fred.
We've had a lot of gift giving between November and now. Fred's going to do some recounting of some of the generosity of our community and what's being possible. But go ahead, Fred.
Yeah, so I did mention a lot on the 16th, our last meeting, that we had a lot of community partners. So I just wanted to publicly thank them. At the middle school, Miss Waddingham and her team received lots of generous donations from not only from the middle school staff, from the Clarksville Community Church, the Mystery Lake Trail Rider Snowmobile Club, the Graldnick family, the Stott family, as well as Lafarge and Sabic, which you saw those donations come through on the board minutes. The middle school was able to support 75 students just in the middle school, and other families were privately adopted as well. Peter B., Miss King and Miss Pula really worked tirelessly with staff and other organizations, Sabic's donations, as well as Lafarge's, able to support 18 families, a total of 38 kids. At the high school, Miss Gell and Miss Dorr were able to donate to 27 students. And that was, again, through a lot of anonymous donors and teachers, and then as well the Lafarge and Sabic donation. A.W. Becker, it was a whole village approach. We had some retired teachers come back. Miss Mulligan helped to really be the driving force behind some of the support for 14 families, local businesses, Log Cabin Quilters, Delmore Reformed Church, Choices Salon, Pizza House, Backyard Sheds, Caldwell Bankers, the Reinish family as well. They all donated over 40 children. And then Miss Abba, who is a retired TA, she also came back to help and was able to get some gift cards for our families and really make the holiday special for them. So thank you to all of our teaching staff and community partners and all the donations. As you know, last time I mentioned that we wanted to sustain some of the food over the holiday break for those who are used to receiving free and reduced lunch. So we reached out to Kindness for Kids, who was our summer feeding program, and they were able to feed 59 students, over 18 families. The Brown Baggett program as well was able to provide food for 56 students. And we had a lot of teaching staff who helped volunteer, and some of our STARS volunteers helped with that. We even had a board member who helped deliver some food as well. So thank you so much for that. I did mention that the Bethlehem Rotary Club is looking to donate to our backpack program, but for now they did a quick book drive, and we're going to give those books out to students. We're trying to minimize the amount of lending back and forth between the school and home. So we're willing just to give books to kids, let them keep them at home, and it'll be part of their library. Can I just share the website real quick, Brian?
Sure.
I'm trying to go fast.
Ask Bray.
I'm trying, Bray. It's not a real presentation because it's not a slideshow. But looking for Mr. McPhee at the top. There's our get to our app. But I wanted to show where we're doing some of our alumni news. So right now we are celebrating Dr. Adam Lamley. So please check out that story. And then also we have one of our high school students who was just accepted a scholarship to Canisius College, Megan Buzas, Division I swimming. So we want to continue to do this. We're going to do some celebrations around the academic successes of our students as well. So download the app and stay tuned. That's all for me. It was my micro machine voice, just trying to go as quick as I could.
All right, we'll turn it over to Mrs. Moran in her quick presentation.
I will be quicker than both of them. So a couple of things I just want to reiterate. Next month or the next meeting on the 20th, I want to remind everybody that we have Mr. Honeywell scheduled to come to that meeting. I've asked our directors to provide updates, which I'll include in the board packets that go out. They're going to do that once a month, so you'll have an idea what's happening in each of the departments: O&M, transportation, building and grounds, cafeteria, that kind of thing. We're starting our real work in the budget process, which is going to be a challenge this year. There's no doubt about it, but we're working on it. I will let you know, again, the state is very quiet. They have not talked about state aid. We are going to anticipate a level of reduction in aid. One thing they did confirm, which is bizarre, is that once again, we even got a sticker on our paperwork that we get from the state for grants that the pre-K grant for last year and this year already slated for a 20% reduction. So that was kind of interesting. It's funny that just the paperwork we get just had a sticker on it. It's been reduced by 20%. Isn't that just wonderful? Kind of crazy in all my years, never saw anything like it. So it's kind of a precursor as to what's to come. I want to remind Pete and Jason, we have building and grounds slated for the 13th. And I'll also be bringing our updated enrollment figures to you at the next board meeting. And that's what I have.
And I'm going to say one last thing. I apologize. Our staff who have come to work every day are brave. This has been a difficult time since March. It's been a scary time since March for fearing for our own safety and our family's safety. Our staff, in light of all of the things that are happening, are continuing to come to work and make this possible for the children of our district. They are brave. And I cannot express enough appreciation for their willingness to continue to do this work in the face of all the things that they've been confronted with. And they're doing it in person. And they're not given enough credit in the public eye at the state level or at a local level. They are doing some of the most important work along with medical professionals, and I thank them on behalf of the parents who have expressed gratitude that we are here for them.
Great.
I second that.
Yeah. It's challenging times for everyone, for sure. And yeah, we're getting through it and they're adapting, and we'll make it through. Things will get better.
Yep.
So thank you, everyone. Does anyone have any new business or old business to go over? No? We have no committee reports, no policy adoptions, no hearings and petitions. Next BOE meeting is January 20th. Same time, same place. And I need a motion to adjourn. Mr. McFerrin, Mr. Ross, all in favor?
Aye.
Aye.
See everyone later. Thank you.
Bye.
Bye.
Bye.